day I noticed that dull ache in my knee wouldn't go away changed everything. At first, I dismissed it as just another gym injury. Weeks passed, and the pain only intensified, especially at night. That persistent pain was my body's first warning, one of the critical signs that shouldn't be ignored when it comes to bone health. Let's explore these crucial warning signs that your body might be sending you signals that, when recognized early, can lead to faster intervention and better outcomes. Persistent bone pain that intensifies at night or with activities stands as the most common symptom. This isn't your typical muscle soreness that fades after rest. Studies published in the Journal of Clinical Oncology show that over 85% of bone cancer patients report this distinctive pain pattern that worsens during periods of rest, particularly at night. The pain occurs because cancer cells cause pressure within the bone and damage bone tissue, triggering pain receptors. Unexplained swelling or noticeable lumps near affected bones might appear as the tumor grows and pushes against surrounding tissues. Researchers at Mayo Clinic have documented that approximately 45% of patients with osteosarcoma, the most common type of primary bone cancer, present with visible or palpable masses. These swellings may be warm to touch and tender when pressed. Unexplained fractures can occur because cancer weakens bone structure. Bones affected by cancer lose their structural integrity, making them susceptible to breaking even with minimal trauma. The Journal of Bone and Joint Surgery reports that pathological fractures occur in about 10–30% of patients with metastatic bone disease, often becoming the first indication of an underlying problem. Limited mobility and joint stiffness around the affected area happens as tumors grow near joints or along the bone. This can restrict normal movement patterns and cause stiffness that doesn't improve with typical remedies. A study in the European Journal of Surgical Oncology found that 65% of patients with bone cancers affecting joints experienced significant mobility limitations before diagnosis. Fatigue and general weakness might seem nonspecific, but when combined with other bone-related symptoms, they become significant. Research published in Supportive Care in Cancer shows that over 80% of bone cancer patients report unusual fatigue months before diagnosis. This occurs because the body diverts energy resources to fight the abnormal cell growth. Weight loss without trying is a common cancer symptom, including bone cancer. According to the Journal of Clinical Oncology, unexplained weight loss exceeding 5% of body weight over 6 months appears in approximately 40% of patients before diagnosis. This happens because cancer cells consume energy and alter metabolism. Fever or night sweats that come and go without any apparent infection may indicate your immune system is responding to cancer cells. Anemia sometimes develops as bone marrow function becomes impaired. Research in the American Journal of Hematology indicates that approximately 30% of patients with bone marrow involving cancers develop anemia before diagnosis. Changes in urination patterns or bone pain that worsens when urinating can indicate that cancer has affected calcium metabolism. Research published in the Journal of Clinical Endocrinology shows that approximately 30% of patients with advanced bone cancer develop hypercalcemia, which can cause increased urination, kidney problems, and intensified bone pain. These symptoms don't necessarily mean you have bone cancer. Many can result from less serious conditions. If you're experiencing persistent bone pain, especially at night, combined with any of these other symptoms, consulting your healthcare provider is essential. Modern diagnostic techniques like MRE, CT scans, and bone scans can detect bone abnormalities with remarkable precision. Blood tests that measure levels of alkaline phosphatase and other bone markers can provide additional information about bone health. Tracking your symptoms systematically can help your healthcare provider make more accurate assessments. Note the timing, intensity, and triggers of pain. Document any changes in mobility or the appearance of swelling. This information becomes invaluable during medical consultations. In my case, that persistent knee pain led to an early diagnosis and successful treatment. Don't let fear prevent you from seeking answers. Knowledge truly is power when it comes to your health. Remember that most bone pain doesn't indicate cancer, but persistent symptoms deserve professional attention.